Assalamualaikum warahmatullahi wabarakatuh. Our specific cancer is on leukemia. Why we want to analyze the epidemiology of leukemia is because we want to gain an insight on the prevalence of leukemia and the statistic of the incidences. Second, we want to understand the characteristics of those who got affected most and their risk factors. Third is to identify the cost spent to treat leukemia and how much money spent by the health system to manage these diseases. First, we should know what is leukemia. Leukemia is a broad range of blood cancer which affects bone marrow and results in the abnormal leukocytes. The abnormal leukocytes increase quickly and destroy normal blood cells. People affected by leukemia are prone to infection as the leukocytes are not functioning properly. Leukemia occurs because of the DNA damage in the developing cells and causes the cells to grow and divide uncontrollably. As they are produced more by bone marrow, it will be overproduction as they do not die at a natural point on normal cell cycle. There are several different types of leukemia, and it can be acute leukemia or chronic leukemia. Sudden onset is called acute leukemia, which means that the cells multiply quickly. A slow onset is called chronic leukemia, referring to the disease progresses slowly and shows marked symptoms. The four most common types of leukemia are acute lymphocytic leukemia, acute myeloid leukemia, chronic lymphocytic leukemia, and chronic myeloid leukemia.
Next, we will move on to the statistics of leukemia. The statistics discussed are the incidence, mortality, and prevalence of leukemia at the level of rural Asia, Southeast Asia, and Malaysia in 2018. For the first part, in a study done worldwide in the year 2018, the number of cases for incidence are 437,033 cases. For mortality, the number of cases are 309,006, and for its 5-year prevalence, the number of cases are 1,174,433 cases. We will now move on to the statistics of leukemia in Asia. In terms of its incidence, Asia has the highest incidence with a total of 212,702 cases, making up 49% compared to other continents. For the statistics on mortality of leukemia, Asia also records the highest number of cases of 165,927 cases. Among all the continents, Asia makes up 54% of the total mortality cases due to leukemia. Next, for the 5-year prevalence, with the number of cases of 561,322 cases, Asia records 48% of prevalence in leukemia. The next part is statistics of leukemia in Southeast Asia. For its incidence, the number of cases are 35,022 cases. Compared to other cancers, leukemia makes up 3.5% of cases in Southeast Asia, with the cumulative risk of 0.48. In terms of mortality, the number of cases are 29,311 cases, making up 4.6% of cases compared to other cancers, with cumulative risk of 0.42. Other than that, leukemia's 5-year prevalence in Southeast Asia has a number of cases of 93,355 cases. Lastly, the statistics of leukemia in Malaysia is to be discussed. In Malaysia, the incidence of leukemia has 1,717 cases, making up 3.9% from other cancers, with the cumulative risk of 0.46. For the mortality rate, Malaysia recorded 5.2% of cases of leukemia compared to other cancers, with 1,377 cases, with the cumulative risk of 0.37. Other than that, the 5-year prevalence of leukemia in Malaysia has a number of cases of 5,361 cases.
Epidemiology analyzes characteristic of risk population in leukemia. Who is at risk? Smokers, The more cigarettes smoked a day, the higher risk of cancer. It is related to the content of the cigarette smoke, which is high in benzene and radioactive matter that can cause leukemia, and one of the common types of leukemia can be seen in smokers is acute myeloid leukemia. Children. Children are commonly observed to have all types of leukemia, while others commonly seen with chronic leukemias. Chemical agent exposure or chemotherapy for past treatment can be one of the contributing factors. And men. Men are more likely to have leukemias than female in most studies. And then rare congenital disease like Down syndrome has high risk to develop acute type of leukemias. Family history. Family history individuals with relative or maternal or paternal lineage of acute myeloid leukemia or acute lymphoblastic leukemia may be predisposed. It is found that higher risk factor in increasing maternal age than paternal for childhood acute lymphoblastic leukemia. Cause of diseases. The cause burden of diseases has found to be super expansive from the treatments between the diagnoses, especially with acute types like acute myeloid leukemia. As the real world claim, $156,000 is the only average limit allowed for the annual spending of blood cancer diseases as the high cost required. The limited annual spending in most healthcare systems can only be justified from the hiking amount of spending of the diagnosis. Patients with acute leukemias found to be the highest out-of-pocket cost covering of healthcare costs between the diagnoses. Acute leukemia and multiple myeloma are only recorded as the most expensive one.
All in all, leukemia is a common disease occurring in Asia and affected both children and adults. It is crucial to have a checkup at the health settings if the symptoms appear for further diagnosis. When these symptoms appear, the doctor will ask for the family history because it contributes to the high risk for the disease occurrence. Then, several tests will be done after physical examination, such as blood tests, tissue biopsies, and imaging tests to observe the cancer cells under microscope. If it is confirmed with the diagnosis, the patients will be treated depending on the type and stage of cancer. The treatment usually involves chemotherapy, radiation therapy, stem cells transplantation, immunotherapy, and so on. However, some factors may affect the effectiveness of the treatment, especially when the disease occurs involve chromosome mutation. Yet, it is still important to diagnose the leukemia early and get treatment faster. Every illness has a cure, and true faith requires total reliance on God. Illness can be seen as a trial by God for atonement and improved spiritual of human. Seeking for treatment is one of the ways for us to show our efforts in improving our health and how we appreciate the blessings given by Him. That's all from us. Thank you.